there is a few classes of drugs that have shown interest. I've already mentioned the menin inhibitors. I think they're very intriguing. I think there are some novel combinations that are still emerging. So people are very excited about the combination of the so-called all-oral regimen. So, for example, Venetoclax plus Gilteritinib as a regimen for relapsed refractory AML. That this data has been presented in prior years in smaller numbers, but it's going to be updated this year by my colleague, Dr. Dover, and some of my other colleagues actually, showing a very impressive response rate in patients with relapsed refractory FLT3 mutated disease, even in those who had previously received FLT3 inhibitors. So I think that's very exciting. I think the Venetoclax, the BCL2 inhibitor, has obviously been a major development in AML, particularly in combination with hypomethylating agents. I think there is additional abstracts looking at the combination of Venetoclax, not just plus HMA, but plus some traditional induction or reinduction regimen. So there is a Venetoclax plus 7+3 regimen, for example, that is being presented. I know that there is another one, Venetoclax plus CPX-351, also known as Vyxeos, I believe in relapse refractory patients. So Venetoclax, it seems like it's falling in various different combinations and being looked at. Now, as I mentioned, the most exciting data that has emerged in the last few years around Venetoclax has been its combination with HMA, which showed to be superior in survival in a large phase 3 data, the VIALE-A study, compared to HMA alone. So a lot of data is going to come from that phase 3 trial, I think presented in abstract and presentation fashion at this year's ASH meeting, among which I think some of the more important aspects would be how to manage some of the challenges with the regimen, including cytopenias. And I think there may be approaches that you can sort of reduce the duration of Venetoclax in certain settings so that the drug can be better tolerated. So I think overall, there is a lot of exciting new emerging data coming together. In combination alone, phase 1 data. One other thing I would say is that there is ongoing efforts to try and explore new targets in AML and myeloid malignancies, whether, in terms of immune approaches. So those would be combinations with immune checkpoint inhibitors, combinations with CD47 antibodies, combinations with CD70 antibodies. So I think, and also the bispecifics and the DARTs, I think those are still very much early, sort of emerging out of phase 1 and perhaps being soon translated into larger, more advanced phase trials. So that area too is moving forward.